All right, let's dive right in. We're going to pull back the curtain on the world of pharmacy law and figure out exactly who's calling the shots when it comes to your prescriptions.
Have you ever been traveling or maybe moved to a new city and all of a sudden the rules for your medication are totally different? It can be super confusing, right? Well, there's actually a pretty clear reason why that happens. And here it is. Every single pharmacy in the United States has to follow the rules from two different bosses. Yep, they've got a dual authority system, which means they're juggling two sets of laws at all times, one from the federal government and one from their own state. To make this all make sense, let's use a simple analogy. Think about building a house. You've got the foundation and you've got the blueprint. So the federal government's job is to pour the concrete foundation. They set the absolute minimum safety standards that apply to every single person in the country, no exceptions. But then each state gets to draw up its own blueprint, adding more specific rules and extra protections right on top of that federal foundation. So who are these bosses exactly? Well, at the federal level, the big players are the FDA, the Food and Drug Administration, which makes sure drugs are safe and effective, and the DEA, the Drug Enforcement Administration, which keeps an eye on controlled substances. Then at the state level, your main point of contact is the State Board of Pharmacy. They handle all the day-to-day stuff.
Okay, so how does this all work in the real world? Let's take a look at who's actually in charge of what.
This is where you can really see the split. Take drug approval. Only the FDA can give the green light for a new drug nationwide. But when it comes to controlled substances, the DEA sets the national rules, but states can and do add their own extra restrictions. Same thing with privacy. The federal HIPAA law sets the baseline for protecting your info, but your state can absolutely add more layers of protection if it wants to.
And then you've got areas where the states are pretty much the sole authority, things like licensing pharmacists. The federal government doesn't do that at all. That's 100% up to the state boards of pharmacy. They decide who's qualified to practice and what kind of ongoing training they need to keep their skills sharp.
Now, this brings us to the single most important rule in this whole system. If you remember one thing, make it this. A state can always be stricter than the federal government, but it can never be weaker. States build on top of that federal foundation. They can't start knocking pieces out of it. This is where it gets really interesting. Let's look at three powerful real-world examples of how states use that power to draw a much stricter blueprint to protect public health. We're going to look at how some states have put limits on opioids, how they handle expiration dates for some powerful drugs, and how they make sure patients really understand their medications. First up, the opioid crisis. Believe it or not, at the federal level, there's no law that says how many days' worth of an opioid a doctor can prescribe for someone's first time dealing with, say, post-surgery pain. No limit.
But a lot of states saw how dangerous that could be. So in places like Massachusetts and New York, they stepped in and drew a much stricter blueprint. They limited those first-time prescriptions to just 7 days. The idea is to cut down the risk of addiction right from the very beginning.
Next up, expiration dates. And this one's a real head-scratcher. Federal law has a weird rule for Schedule II drugs. We're talking about powerful medications with a high potential for abuse. Under federal law, a valid prescription for one of these technically never expires. It's good forever. Yeah, you heard that right. But states like California and Texas looked at that and said, absolutely not. That's way too risky. So their blueprint makes those prescriptions expire after just 6 months. This forces a check-in with the doctor to make sure everything's okay before a patient can get more. It's a simple change that adds a huge layer of safety. And for our last example, let's talk about patient counseling. The federal foundation is pretty minimal. It just says pharmacists have to offer to counsel Medicaid patients about a new drug. Notice that word, offer. A patient could just say no, but states like Florida decided that wasn't good enough. Their blueprint says the pharmacist must provide counseling to all patients, ensuring everyone, not just one group, understands how to take their medicine safely. So after all that, why is this two-boss system so important? What's the big picture here? Well, it really is a balancing act. The whole idea is to get the best of both worlds. You get a strong, consistent safety net for the entire country, but you also give states the flexibility they need to tackle their own unique problems, like a local opioid crisis, for instance. So let's just quickly recap the big takeaways. First, federal law is the floor, not the ceiling. Second, states can always get stricter to solve local problems. Third, the whole system is about balancing that national consistency with local flexibility. And finally, that experience you have at the pharmacy counter, it's being shaped by decisions made in both Washington, D.C. and your state capital. And that leaves us with one final big question to think about. As medicine gets more and more complex, we're talking about gene therapies, super personalized drugs. How is this two-boss system going to have to adapt? Are we going to need more federal rules, or will we need even more state-level control? It's a huge question, and you can bet regulators are going to be wrestling with it for years to come.